So are there different age-related macular degeneration treatments for the different types of macular degeneration? Essentially, the principles of the treatment are either to try and prevent or minimize progression, and, if necessary, address neovascular macular degeneration to prevent further visual loss and hopefully even improve vision. So the different types of macular degeneration are the early, or what's commonly called the dry type. And the intermediate stage of macular degeneration is just a more advanced form of this. It is still the dry type. Now, smoking is one of the most important risk factors for macular degeneration getting worse. And one of my passions is to try and stop patients from smoking. I'm not sure if I've personally made a difference on that, but I certainly work with a team of experts who can help. Vitamin supplements are useful in slowing down the progression of macular degeneration when it reaches the intermediate stage. There's no good evidence that they work at an earlier stage of macular degeneration. Now, these vitamin supplements involve very high dose supplements of vitamins C, E, zinc and copper. Vitamin A used to be part of the formulation, but has now been universally removed, and I advise patients not to use excess vitamin A if they have macular degeneration. This would include fish oil supplements such as cod liver oil, which contain sometimes 5 times the amount of vitamin A that we need. Wet macular degeneration, or neovascular macular degeneration, is treated with injections into the eye. Now, that sounds horrific, but it's actually a very safe and well-tolerated process. Patients will typically have multiple injections. It can vary from 3 to 12 injections in a year. It depends on the subtype of wet macular degeneration that they have. There are different types of injections. Eylea and Lucentis are available on the NHS and are the licensed drugs, which in the private sector are more expensive. Avastin is an unlicensed drug that has been very widely used worldwide for the treatment of macular degeneration. It is significantly cheaper in cost than Lucentis and Eylea. And although it is unlicensed, it has been proven to be as safe and effective as Lucentis and Eylea.